All right, so first things first, can you tell me your name and date of birth?
My name is Robert Williams. My date of birth is October 12th, 1955.
First of all, I'm looking at his chest. So is his chest expanding symmetrically, which it looks like it is. I want to measure his respiration rate and, note the depth and the pattern of it. So far, it looks like he's breathing shallow and fast. So he is breathing a little fast for me. He looks a little labored. He doesn't have any oxygen on. He's at 92%, so that's okay. So we just want to note these things. That's just a quick inspection that you can start with. But as we're going to keep going on with this assessment, let's go ahead and listen to his lung sounds. So listening to lung sounds, we have, once again, you want to listen in a sequential pattern. So you want to compare both sides. So we go over, down, over, and then listening to the back is the most important piece, because listening to the back is allowing you to listen to the bottom of the lungs in a better way. Now, the anterior chest is better for the top of the lungs, and the posterior chest is better for the bottom of the lungs. So let's first listen to the anterior chest. So we're going to now go and move on to the back here. So once again, I'm going to show you the correct sequence of listening to lung sounds. Okay, now going over. Okay, so over and now down. Now go over again to compare. Okay guys, so the next thing is we listen to the lungs. The next thing would be palpation and percussion. So once again, palpation and percussion are not typically something that the bedside nurse will be doing for the pulmonary assessment specifically. These type of assessments are typically for those advanced providers that would do these types of assessments, not necessarily the bedside nurse. But it doesn't hurt to actually know them. So palpation, what are we thinking? So palpation, we want to check for chest excursion. So we do have a tape measure in here, which, like I said, this is going to be pretty rare for a bedside nurse if they ever do one. This is essentially checking for chest excursion. So what chest excursion is testing is the actual function of the diaphragm. Now, a normal measurement is 2 to 5 inches, and we can typically check that with our hands by putting our hands on the back here. We can start here and then ask them to breathe as deep as possible, and then our hands would spread out naturally. Now that is the typical way, especially if you don't have a measurement tape. So, but in this case we do, so we're going to put that on. And it's telling us here that his chest excursion is 4 inches, which is normal. Now you could see a diminished chest excursion in a patient with COPD because the diaphragm is weaker and there's increased work of breathing, and their breathing is typically more shallow. Also with palpation, we could do a test called Tactile Fitus. So we would ask them to speak, and what we would do is we'd be putting our hands on their chest, and then we should be feeling a vibration on the chest when they speak. Now, if we don't feel it, that is an abnormal finding, and it could be related to such as mucus buildup or narrowed airways, and it's just blocking that vocalization vibration to the chest. And then lastly, with palpation, another thing you could possibly note, especially if you have a mechanical ventilation patient, this is something I do personally, being from the ICU, that we check, especially any patient who's getting positive pressure ventilation, there is a possibility of air leaking outside the lungs. And you could typically find that in the upper chest here, and you'll press down and you'll feel some popping right underneath their skin. Now that is also an abnormal finding that you would want to let your physician know about. And then lastly, percussion. So percussion is the actual function of tapping and getting a drum-like sound. So the normal sound, just for NCLEX standards and your nursing tests, you're not going to be expected to do this as a bedside nurse for one. But this is something to know for just nursing concept in general. So when you do percussion on the chest, you're supposed to be hearing resonance.